Here are some key points to cover on teeth grinding at night. Bruxism is the involuntary clenching, grinding, or gnashing of teeth, particularly during sleep. While some people may also grind their teeth during waking hours, nighttime bruxism is a common occurrence. Prevalence and impact. Teeth grinding at night affects a significant portion of the population. The potential consequences of untreated nighttime bruxism, including tooth wear, jaw pain, headaches, and disturbed sleep patterns, results in teeth grinding. Please don't forget to like, share, and subscribe for more. Symptoms. Common symptoms associated with teeth grinding at night include waking up with a sore jaw or headache, increased tooth sensitivity, and noticing worn-down tooth surfaces. Viewers should be mindful of these signs and seek professional evaluation if they suspect they have bruxism. Causes and triggers. The potential causes and triggers of nighttime bruxism are stress, anxiety, malocclusion, misaligned teeth, sleep disorders like sleep apnea, and lifestyle factors like caffeine consumption or smoking. Impact on oral health. The detrimental effects of nighttime bruxism on oral health include enamel erosion, tooth fractures, temporomandibular joint (TMJ) disorders, and the potential need for extensive dental treatments if left untreated. Diagnosis. How nighttime bruxism is diagnosed by dental professionals is through clinical examination, patient history, and evaluation of dental wear patterns. Viewers should seek professional evaluation if they suspect they have bruxism. Treatment options of nighttime bruxism include custom-fitted mouthguards or splints to protect teeth from grinding during sleep. Stress management techniques like relaxation exercises and lifestyle modifications to reduce anxiety and tension. Treatment of underlying sleep disorders should be done apnea if present. Dental procedures to restore damaged teeth or correct misalignment issues. Home remedies and lifestyle changes. Provide tips and strategies for managing nighttime bruxism at home, such as practicing good sleep hygiene, avoiding caffeine and alcohol before bedtime, and implementing relaxation techniques like meditation or deep breathing exercises. Long-term management. Offer guidance on long-term strategies for managing and preventing teeth grinding at night, including regular dental checkups, consistent use of mouthguards or splints, and ongoing communication with healthcare providers. Encouragement and support. Provide encouragement and support to individuals struggling with nighttime bruxism, reassuring them that effective treatments and management strategies are available. Encourage viewers to seek professional help and explore various treatment options for symptom relief and long-term oral health. Please don't forget to like, share, and subscribe for more.